Welcome back to Yahoo Finance Live. Now, I know this is a topic that many of you at home are going to be very interested in. Rutgers University is requiring that all students be vaccinated against coronavirus before they can return to campus, which of course raises a lot of legal and even bioethics questions. So let's get into that now. We've got Eric Feldman, professor of medical ethics and health policy at the University of Pennsylvania's Carey Law School. We also have Yahoo Finance's Aarthi Swaminathan also joining for this conversation. So, Professor, I know that colleges and universities already require students, be immunized. When I went to Penn, I remember having to take the meningitis vaccine. But something feels a little bit different here about this, COVID-19 vaccine. So what's the legality here? Is a move like this allowed?
It's a good question. It's the first university or the first major university that I know of in the United States to be mandating the COVID vaccine. And so whenever there's a first like that, one wonders whether or not there's going to be legal challenges. And my guess is there will be, just like there were legal challenges in California when the California universities decided to mandate the flu vaccine. My guess is that Rutgers is on fairly solid ground, and we're likely to see a good number of universities, both public and private, start to mandate the vaccine. We already know that private employers have been given the go-ahead, in a sense, by the government to mandate the vaccine, and many are likely to do so. Some of the airlines have already been making noises in that regard. So my expectation is there'll be legal challenges. Rutgers's effort to mandate the vaccine is likely to be upheld, and we're likely to see that occurring in a variety of other schools.
Professor, there was this recent report that in New Hampshire, I think out-of-state students were not allowed to take the vaccine. Kind of interesting because they wouldn't be there for the entire semester. There's something to do with timing. So it seems like different states are adopting different standards. I'm curious what you think about this issue in New Hampshire versus New Jersey.
Yeah, I think that issue is magnified when we start thinking that a university like Rutgers, it's a huge research university, is having students not just from New Jersey, obviously, and not only from other states, but also from other countries. Some of those other countries are using vaccines that are not approved in the United States yet. And it's not clear to me what Rutgers is going to do about handling a student, say, coming from China, who's received the vaccine that's being provided by the Chinese government, but is not the Pfizer or J&J or Moderna vaccines that Rutgers is requiring. So I think that remains an open question. Certainly the issue of supply is huge. I think Rutgers is assuming, and I hope the assumption is borne out, that vaccine supply will be abundant, certainly by the fall, if not by the May target of President Biden. And so that, I don't think you can mandate the vaccine and then not have enough vaccine to go around. I don't know what's going to happen, for example, with students coming from out of state or out of country who, say, get the Moderna vaccine when they arrive at Rutgers, but it's going to be a good 6 weeks, say, before their immunization fully ramps up. So are they going to be allowed to stay in Rutgers housing? Are they going to be required to stay in private housing? So I think there are a good number of unanswered practical questions, but I think that the big picture question, which is, can universities mandate vaccines, the legal answer, and I think the ethical answer is likely to be yes. And then I think the question that's going to come out of that as well, is everyone going to have to be vaccinated, or might there be some possibility for exemptions? And that's going to open a whole other, I think, interesting Pandora's box of worries.
I actually do want to keep picking on that point there about students, not even so much just out of state, but as you were mentioning, out of country. Of course, we have very varying vaccines around the world right now. China has its own set of vaccines that it's giving to its residents. And of course, we already know that across the world, many other countries are far behind where the United States is in terms of vaccinating its population. And if they're doing it similarly to the way the United States is doing it, college students are pretty much going to be last on the list of folks that are going to be getting vaccinated. So for universities, if they start mandating that their students become immunized, and I was checking some of the immunization requirements, at least of right now, typically a lot of these universities will allow you to remain on campus, take classes, etc., as long as you've been in process. But is this something that, at least on an ethical level, that if the United States is willing to take on these international students, that we also therefore need to take on the responsibility of vaccinating them as well, especially if they don't have access to some of those vaccines at home?
Yeah, look, I think the easy case is a student who is coming from a country outside the United States, who is unvaccinated but given permission to enter the United States. And of course, border crossings are and remain a significant impediment to movement now. But if we assume there's a student coming from country X who can get into the United States and is unvaccinated, that's relatively easy for Rutgers. I think they'll have plenty of vaccine available by midsummer to start vaccinating non-US resident students coming to Rutgers. And these may be American citizens who've been living abroad. These may be citizens of another country. I think the tougher case, and the one you just alluded to, is somebody coming from China who's vaccinated with the vaccine that the Chinese government has authorized, where so far as I know, we have no data on the safety or efficacy of revaccinating that person with one of the vaccines approved in the United States. And so then what do we do with that student? Do we decide that they don't count as having been vaccinated and therefore they're not allowed to attend any classes, but we need to accommodate them somehow by allowing them to attend class remotely? Or do we continue to collect data on the safety and efficacy of the vaccines being used in Russia and China, et cetera? And if they meet whatever standard we believe, or Rutgers believes, is roughly equivalent to the standard of the vaccines being used in the United States, then they can matriculate. So there are going to be some hard questions, I think, for students coming from overseas. I think they're all answerable ultimately. My guess is, or my hope is, that the vaccines being used outside of the United States turn out to be equally efficacious. At this point, I think that appears to be the case, but I think the jury is still out with regard to what the data is ultimately going to look like.
Professor, I'm curious, there was already a lawsuit from the against the LA Unified School District. Is that just a knee-jerk reaction, or is that going to be something that will accelerate? I'm curious about your perspective on that.
I think we're likely to see a variety of lawsuits. I mean, I think we'll see lawsuits challenging the legality of mandating the vaccine at all. I'd be amazed if we didn't see lawsuits against Rutgers or other employers or universities mandating the vaccine, brought by people who claim to have had an adverse reaction to the vaccine. You know, I got vaccinated and I then had a stroke or heart failure or some other extreme reaction. So I think we'll inevitably see challenges both to the principle of mandates, to the consequences of the vaccine, and then arguably, depending upon whether other schools do what Rutgers has done. And Rutgers has said, you've got to get vaccinated unless you are exempt. And you can be exempt either by having a pre-existing medical condition that would make your vaccine dangerous. And for that, you need a letter from a medical provider, or you're exempt if you have a religious exemption. Now, New Jersey has religious exemptions, but California doesn't, New York doesn't. So I think one is likely to see challenges in states as well, where universities mandate vaccines and people believe they should have an exemption that the university is depriving them of. So you're absolutely right.
Professor,
yes.
Sorry to interrupt. I really want to ask you this about some of the broader implications, because obviously what we're talking about right now is for students, but what happens for us adults? You know, can employers start requiring these vaccines of their employees before they're allowed to return to the office? And what could be facing some of those employers if they start getting challenges from their employees?
I think broadly, it's quite clear. The EEOC and others have made clear, I think, that employers can mandate the vaccine. Whether universities are going to be successful in mandating the vaccine for faculty and staff, I think, is a different question. That's likely to depend to some extent on whether the university is public or private, whether the faculty is unionized or not unionized, what the contracts between the faculty and the administration look like, et cetera. It's a hugely important issue, I think. At the end of the day, it's likely to be the faculty more than the students who are at risk from developing severe illness or perhaps dying from the coronavirus. Students are less likely, though certainly not immune from those sorts of problems. So one would hope that the faculty, just by virtue of self-protection, if not the concern for others, would be vaccinating on their own. But I think students are perceived as a high risk category for continuing to spread the virus. They live in close quarters, they're close together in classrooms, et cetera.
All right, Eric Feldman, professor of medical ethics and health policy from the University of Pennsylvania Carey Law School. Yahoo Finance's Aarthi Swaminathan. Thank you both so much for joining us today.